Greetings. My name is Ealey, and I am obtaining my Master's of Education in Community Development and Action at Peabody College. I am completing my practicum as the Lead Health Navigation Specialist with the Tennessee Alliance for Economic Mobility and am presenting on the Our Chance Tennessee pilot project. The title for my research focus is Increasing Capacity and Wellbeing when Moving Beyond the Benefits Cliff. My community partner is the Martha O'Brien Center, and my faculty advisor is Dr. Sarah Suter. So a bit about the background, the Tennessee Department of Human Services has selected the Martha O'Brien Center and the Tennessee Alliance for Economic Mobility, which is a public-private partnership comprised of 32 organizations, to receive a $25 million grant entitled the Tennessee Opportunity Pilot Initiative Implementation Grant. This is designed to reimagine how the state supports families in moving out of poverty and into opportunity. We are essentially exploring the interconnectedness between economic mobility and well-being. By supporting 900 families in 7 Middle Tennessee counties, TAME, housed at the Martha O'Brien Center, will demonstrate and evaluate a new way forward for Tennessee's safety net, thus creating a scalable statewide solution that incentivizes employment and increases family self-sufficiency. The 7 counties include Dixon, Murray, Wilson, Sumner, Montgomery, Rutherford, and Davidson County, of course. So the purpose of this pilot project and TAME's approach is designed to mitigate the effects of a phenomenon called the benefits cliff. So the benefits cliff is a broken piece of public support system that leaves low-income families worse off financially when they increase their income because they abruptly lose their benefits. So as you can see in this graph, which reflects a snapshot of a current real-life experience of a single caregiver with 2 children in Dixon County, the value of their increased income is less than the value of the lost benefits, meaning their net resources at $22,000 are the same at $46,000. Therefore, families are left in a worse financial situation. The benefits cliff forces caregivers to make difficult yet sound decisions to not increase their income or pursue education in order to maintain their safety net to support their families. The disincentive for caregivers to pursue increased education and earnings subjects them to being and feeling stuck. One of the ways that TAME goes about remedying a system-level barrier to quality of life and well-being for Tennesseans is by first randomizing participants into 3 pathways. Each pathway consists of different combinations of services and meeting frequencies, which allows us to assess which combination of services prove the most effective way of meeting objectives that I will later discuss in this presentation. So my role as the lead health navigation specialist is to work collaboratively with care holders at the system level across those 7 counties. I use a needs assessment-based data collection tool applying a health equity lens and community organizing framework to identify and fill gaps in wellness and resources. So our objectives, there are 2 here. One, or a couple for the program, is to trigger the benefits cliff by increasing wages and education. The other is, once those cliffs are triggered, to provide transitional benefits and customized support for our caregivers, ranging from access to childcare, financial coaching, family-centered coaching, county resource navigators, access to healthcare and wellness resources. So for health and wellness, some of the objectives include streamlining resources to caregivers through locally led health needs assessment processes across the 7 counties, increasing physical and mental well-being through community partnerships, such as connecting families to mobilized medical and dental units through engaging Meharry Medical School. Another is collecting data on self-sufficiency progress from crisis to thriving using a tool called the Arizona Self-Sufficiency Matrix. So our data reports, our data team built out a Salesforce system allowing me to request data to tailor proactive support for individuals who self-report health and wellness resource interests. Our data team ran a report that revealed that out of 179 caregivers with customized plans, upwards of 546 goals, 46% of those caregivers are seeking health and wellness resources. Although not captured on this poster, 100% of our caregivers are seeking increased employment, 73% are seeking adult education, and 66% are seeking housing. So, what are our intended outcomes? Throughout the duration of the pilot, we will administer follow up data collection to participants within 6-month intervals. From those surveys, we would like to see the following outcomes. So, first, families increase their physical, mental, and emotional well being by 10%, outlined in the Arizona Self Sufficiency Matrix. I had the pleasure of developing and contributing qualitative measurements for physical and emotional well being domains. Another is to increase health and wellness resource access for insured and uninsured individuals through a closed loop system that key stakeholder groups are developing, such as United Way's Raising Readers and the Tennessee Department of Health's County Health Improvement Process Program, known as CHIP. Both are working groups that I am currently serving on. Another is families increasing their earned income beyond one or more benefits cliff. And of course, benefits are SNAP, TANF, Medicaid, just for example. And of course, eventually state and federal reform that is catalyzed by TAME's collaborative work here in Tennessee. So we have big goals. Some of the lessons learned, although not comprehensive, we are finding that caregivers are self-reporting between 3 to 4 on physical, mental, and emotional well-being scale, yet reveal to their family coaches that they lack access to health and wellness resources, thus more accurately scoring them at a 1, 2, or 3. We also found that families face fear regarding losing their benefits and need support with mindset shifts out of survival towards long-term success. So I am developing a mindset shift workbook to support short and long-term planning, delayed gratification, and healthier daily habits for our caregivers and anyone who uses the workbook. We learned that integrating the stages of change model during recruitment optimizes participant retention. So we are able to recruit caregivers who are at the preparation and action stage, really ready to move beyond the benefits cliff and get beyond feeling stuck. In a human development and prevention science class, I learned of the U.S. Preventative Service Task Force web tool. I found that this can increase caregivers' self-advocacy for and during doctor visits, in which I'm including in the how to set and navigate a doctor's appointment toolkit as a part of my practicum deliverable. And the goal is to, of course, again, increase caregivers' self-advocacy. Last but of course not least, compared to housing, childcare, and transportation, we're finding that health and wellness is not deemed a high priority unless it's in a state of crisis. So this finding is what inspired me to re-engage the data to initiate engagement initiate engagement from caregivers seeking health and wellness resources. So our acknowledgements, because this requires a team of brilliant individuals, the TAME team, the Martha O'Brien Center, Elevate Consulting, family coaches, county resource navigators, benefits specialists, education and employment specialists, our partner agencies, and of course, TDHS for this grant. I give a special thanks to Dr. Sarah Suter, Mariela Vecchio, Mikola Harris, and Cheyenne Figueroa. Thank you so much for this opportunity.